Welcome to Bayside Orthopedic Sports Medicine and Rehabilitation Center's informational DVD about total hip arthroplasty or total joint replacement for the hip. If you're considering a joint replacement, you've probably completed a course of medical management for your hip arthritis. This may have included anti-inflammatory medications and physical therapy. If you're to the point that your quality of life is significantly affected by your hip arthritis, and medical treatment is no longer of sufficient help, then you're ready to consider a more involved surgical option. The hip replacement is necessary because the cushion or cartilage in the joint has worn out. The muscles are opened either in the front or the back of the hip, with the patient laying on their side. The capsule is then opened so the hip can be dislocated. The socket is cleaned and the arthritis is reamed away so that a new metal socket can be press-fit into the bone. A plastic liner is then mated into the metal cup. Next, the inside of the femur is carefully opened from the top and sized so that the femoral stem can be inserted into the bone. It is either press-fit or cemented into place. Then a trial ball is fit to the stem and the ball is put back into the hip socket. The stability and length of the leg are assessed and a final ball is selected. The hip is put in place and the muscles and skin are closed. Your surgeons at Bayside Orthopedics have worked hard to offer you the latest in surgical techniques and prosthetic components for joint replacement surgery. You've probably heard of minimally invasive surgery, which involves using smaller incisions. But actually, MIS involves a whole series of steps that make the recovery faster and less painful than older surgical techniques. This first involves preparation before surgery with an exercise program that strengthens your hip and knee. This is so you can use your leg much sooner and with more security after surgery than may have been accomplished in the past.
What I'd like to show you are the exercises that you should do preoperatively before your surgery. And it's very important that you do these. It will make a difference in the outcome and the ease of your therapy, okay? The main goal prior to surgery is that you gain strength. Any strength gains that you can make now is going to benefit you after the surgery.
It also involves preempting the pain that you might have after surgery by taking medications for pain and inflammation prior to your surgery, particularly the day before and the morning of. Then, after your surgery, you will be asked to rehabilitate fairly quickly. You may begin walking the same day or the day after your surgery. Either way, it will be important for you to begin lifting your leg well. After surgery, there will be extensive exercises that you'll need to do.
And left. Wonderful. The specific goals are pain reduction, swelling reduction, restoration of range of motion, and strength in a normal gait. And then returning to their normal lifestyle without pain and with better function.
Although this total hip replacement surgery is less painful and recovery has the potential to be significantly faster than in the past, it still has some pain and some physical therapy is necessary. Your leg may be swollen for several weeks. It is common to require some narcotic use for 6 to 8 weeks after your surgery. Potential complications for this surgery include an injury to an artery or nerve, infection, joint dislocation, a blood clot in your leg, a difference in your leg length, or the possibility of needing a transfusion. You may be asked to continue with anti-inflammatory medications and some narcotics for several weeks after your surgery. You may experience constipation and a dry mouth as a result of the narcotics.
The short incision and the quickness of the surgery, it's unbelievable. I feel so much better. When I do the exercises and get up and walk, I have some pain, but it's basically soreness from the surgery. I'm taking very little pain medication. I think I've had 4 pills since yesterday morning.
The recovery was aided, in my opinion, by a very disciplined exercise regime.
Well, you're just moving right along.
Today I'm doing much better. The pain is soreness. I don't have any pain. It's a little soreness and stiffness. I use a pain pill to take a nap. I don't need them for pain at all.
And my mobility is pretty good. As you can see, I can walk pretty good, backwards, sideways. I can steer pretty good, you know what I'm saying? Most part of my health, it's like when I get up out the bed or I go to the bathroom or something like that. Other than that, though, I'm doing pretty good.
If you have any further questions or concerns about hip replacement surgery, your personal Bayside physician will be happy to discuss them with you. Thank you for watching this presentation.